In this video, we're going to review using AI to help us write a daily note. So I got my template up. This is the template I like for daily notes. If you want to change any of the instructions, these are just the boxes. All you would do is just click there and then just make changes. So I can say like write 2 to 12 sentences based on this. So I'm gonna hit record. Say Brett felt okay after the first session. He notes about a 10% improvement in the intensity of his low back pain. Brett continues to be limited lifting more than 20 pounds from the floor. Continues to be limited lifting his child. Continues to be avoidant of activities that cause a higher impact, such as walking on uneven terrain or hiking. Brett does note some improvement with twisting motions, as he said he had less pain and difficulty getting in and out of his car. And Brett continues to have pain during the first hour of the day, which makes it difficult to get ready for work. Past medical Past medical history is relevant for high blood pressure. There's no complicating factors that might affect plan of care. Brett's diagnosis is consistent with vertebrogenic, VERTEBROGENIC, low back pain. Whenever there's a tricky word, I just spell it out so the AI knows. I can use like a clinical practice guideline diagnosis. I can say Brett presents with low back pain and mobility deficits. Supporting this diagnosis is the absence of radicular symptoms and the loss of lumbar range of motion in multiple directions. So here I can pull my objective measures from the eval. I can say Brett's lumbar flexion improved from 30 to 33 degrees. Lumbar extension improved from 15 to 18 degrees. Myotomes, dermatomes, reflexes are still normal. Lumbar extension strength is still 4 out of 5. Here's my treatment from the first time, so I might make some changes, might add a couple things. So I could say like therapeutic exercise. We did the Thomas stretch. We did a prone quadricep stretch, hip internal and external rotation stretching. We added prone press ups and lateral lumbar glides and standing. Neuromuscular we did resisted pelvic tilts in a variety of positions, including sitting, supine, and with trunk flexion. Brett required tactile cueing for correct motor control. Manual therapy, we did graded lumbar mobilizations and prone. We did a sitting thoracic spine manipulation. We did some hip physiological mobilizations to improve hip mobility. Therapeutic activities, we were able to progress hip hinging by adding 10 pounds. We worked on trunk flexion and returning to a fully erect position. Brett continues to have thigh push off Gower sign when he bends forward and returns to an upright position. And then based on what you've said, it will write the assessment. Plan of care is for 2 times a week for 12 weeks. And then I hit stop. And then once this is ready, then you just hit comprehend. Writes all this for you. Under functional deficits, it'll tell you range of motion differences. Typically, I delete these boxes and then just check to make sure everything's in the right category. So it did not add the prone press ups or the lateral shift correction. Sometimes if it doesn't add something, I just delete it and then just go to the box and try to add it that way. And usually that works. Here you can see it added the 2 missing. It added stuff from other categories, so I just deleted that. Got everything for manual therapy, therapeutic activities. Here's our assessment. I just proofread that quickly. And then the goals, it always adds to it. So just delete that and keep it at independent with home exercise program. I usually leave this blank, but you could do, sometimes you can add something if you like. And that's all.